This conference will now be recorded.
And friends and guests, that was the Star Spangled Banner as the Sonata national anthem. We were happy to welcome you to the Star Spangled Banner to the Women Veterans Military History Week. I want to please remind all guests to turn off their mics when they are not speaking, and presenters as well. It does help the bandwidth if you have your cameras off, but please do turn your camera on when you are welcome to the mic. Wonderful. Very good. Now, in honor of Women's Military History Week, I will now present the Governor's Proclamation before we move on to our next presenter. California's women veterans are part of a long and proud legacy of military service. Throughout the years, women went to great lengths to serve alongside their male counterparts. Historically, many disguised themselves by dressing as men, leaving behind their homes and families to pledge their lives in allegiance to this nation. Women sacrifice so much to serve their country, yet far too often they have done so without recognition and the gratitude they deserve. From the American Revolution to World War II, history recognizes that women traditionally served in low-level positions, in covert operations, and as nurses. At the time of their service, many women went unrecognized, including those who served on the front lines. It is our privilege and honor to recognize the legacy of pioneering women like Deborah Sampson and Secret Operative Agent 355 during the Revolutionary War. Harriet Tubman and Kathy Williams, who worked with the Union Army in various capacities during the Civil War. The women fighter pilots who flew combat missions in 1998. General Anne Dunwoody, the first woman in history to achieve 4-star officer rank, and Brigadier General Susie Coulion, the first woman to command the Iron Man Division, Reserve Infantry Army Unit. In 2013, Defense Secretary Leon Panetta rescinded the military's exclusion policy and officially recognized women in combat. In 2016, the Department of Policy officially recognized, the Department of Defense opened all combat positions to women with no exceptions. Women are now finally afforded the opportunity for not just recognition, but for equity in military careers and rank, achieving and excelling as commanders, elite operatives, and military personnel. Women veterans are the fastest growing combat cohort of women veteran community, with over 163,000 women veterans living in California. This week, we salute our women veterans for their courage and significant contributions to our nation's armed forces, and recognize that we owe all military women and men our deepest appreciation and respect. I'm Governor Newsom proclaiming March 15 through 21, 2021 as Women's Military History Week. Very good, friends. All right, thank you again for helping us kick off a great Saturday in honor of women in the military and women veterans. I will now like to welcome Commissioner Dan Brown from El Dorado Veterans Commission, who is joining us today to say a few words and to recognize some of our women in the military. Welcome, Commissioner Brown.
Thank you very much for your invitation. First and foremost, I want to thank each and every one of you for your service to our country. And I have the privilege, I don't know if you can see the artwork that was presented by Lisa Udzik Myers, but it's a real nice poster you might be interested in. I had the privilege of presenting challenge coins to two very accomplished business women who were in the United States service. One was Claudia Zapata. She operates a family-owned business that's been in Tahoe for 30 years. She was a member of the United States Navy and served in Jacksonville, Florida. The other young lady is Lisa Udzik Schaefer. She was in the United States Army. There, she served. She was attached to the 10th Mountain Division, and she served in Bosnia for a year. These are two very accomplished young women in South Lake Tahoe. They were born and raised in South Lake Tahoe, and you know, they both graduated from South Lake Tahoe High School. I would, you know, I was very honored, you know, to become, you know, a part of their experience. And again, I want to thank each and every one of you, and also Claudia Zapata, and also Lisa Udzik Myers for their service. And it's just been a privilege to do this presentation before this event today. And I want to thank you very much. And thank you again for your service.
Thank you, Commissioner Brown. We would love, of course, a poster. We can get in touch via email with your assistant. Congratulations and thank you for your service to Claudia and Lisa. Thank you, sir.
Thank you. Thank you again.
Very good, friends. So for today's agenda, you will have a presentation on benefits and service, as well as some fun activities throughout the program. If you have any questions throughout the program, please feel free to send them over in the chat, and we will take care of you. Next, I'm going to welcome Dr. Leslie Farmer from the Women's Health Medical Director. She's the Women's Health Medical Director, excuse me, from the VA Northern California Healthcare System. And Dr. Farmer will give us we'll open up with some remarks, and then we'll go over the presentation.
Terrific. Hi, everyone. I'm very happy to be here. Welcome. I just want to say that today we celebrate March, which is Women's History Month. This is a time when we should pause and reflect on the great achievements and recognize all the contributions that have been made by our military women from all branches of our service. You know, our mission here at VA is to provide excellent health care, and we try to do this both as comprehensive medicine as well as holistic care. And I think that we've really tried to embrace both sides to give a full comprehensive treatment for our patients. We really hope that we offer the privacy and sensitivity to our patients and give them the gender specific needs that our women veteran really deserve. We continue to honor and acknowledge their contributions to our country, to serve them with dignity and the respect that they deserve. We have a lot of great information that we're going to pass along today. We'd like to give a special thank you to Karen Carter. She is at the VBA, and she's going to be one of our presenters here today. We would also like to thank you, the partnership with the California Department of Veteran Affairs Women Veterans Division and the Women Veterans Alliance. I think we have a fun event today, so I hope everyone sits back and relaxes and enjoys the show. I think I'm on next, so that's why I'm still here.
That's okay. That's okay, Dr. Farmer. Thank you for that warm welcome, and go for it. Whenever you are ready, we appreciate it.
Okay. So I'm going to be talking on some preventive care tips, and this is specifically designed for our women veteran. But it can be helpful for anyone who'd like to listen along, but it's specifically targeted to our women veteran today. So next slide, please. So what I'm going to do is I'm going to kind of talk about different decades of life And we're going to start off with the 20s and 30s. And the one thing I'd like to say is that what you do in this decade will really have ramifications of your whole life to come. I know that sounds a little ominous. I don't mean it to sound ominous, but I think as healthy as you can be early on and start to really embrace healthy habits, this is a good time to really get those habits in action. The first thing I'd like to talk about is protecting yourself against sexually transmitted diseases. We see quite a lot of chlamydia and GC, which is gonorrhea. There's been a real uptick here in the Sacramento area for some reason, maybe COVID stuff, I'm not sure, but we've seen an uptick in these diseases as well as syphilis. So these diseases can be easily screened for. The chlamydia and the gonorrhea screening is usually done at the same time a pap smear is done. It's just a simple swab test that we send off. The unfortunate thing is that if a woman has a chlamydial infection, that can really cause a lot of damage to the reproductive system, and in the worst case scenario, cause scarring of the tubes and lead to infertility, which is tragic. We really recommend using condoms, even if you're using a different type of birth control method. Condoms are the best way to protect yourself against the STD or STI infections. HPV is a very important vaccine, and if those of you who have not had this vaccine yet, I would really promote it. We used to only be able to give it up to the age of 35, but now we can give it up to the age of 45, which is great. HPV helps to protect you against the virus that causes warts and cervical cancer. So it's a very important vaccine to get. Then the next thing on the list there is, oh, and let me say, if anyone has any questions, just put them in the chat box. I think we can get to the questions at the end. So as I go through this talk, I don't want to just kind of drone on. If you guys have questions, please let me know. Selection of birth control is very important. There's a number of different methods, IUD and Nexplanon, and I forgot to mention there the Depo-Provera shots are probably the most, well, they probably work the best. As you go down the list there, pills and patches and NuvaRing, they're a little less predictable. Pills and patches are probably about 80 to 90% protective. The IUD and Nexplanon gives you into the 90s of protection. So they're a much more reliable form of birth control method. Also, the IUD is great because it will last for 5 years once it's implanted. So it's very convenient. Condoms and rhythm method are not so reliable. Those are probably only about 70% protective. Also, the desires of the patient is important. If you want to become fertile, you probably shouldn't be on a long-term implant like the IUD or Nexplanon because that is less reversible. Something like pills or patches, which are more easily changed, is better. If you have really heavy periods, things like IUDs and Nexplanon are helpful, as well as the Depo-Provera shot, and that can help to decrease the amount of flow. Also, if you have migraines with auras, we typically do not want to do a lot of estrogen products, so those people may do better on progesterone-only therapy. Excuse me. And if you have a BMI greater than 30, we don't recommend patch because that may not be as effective. Also, there's some I didn't put it on my list there, but there are also some medications that may decrease the effectiveness of birth control. So it's always a good idea to talk to your provider about the new medications that you're put on and make sure that they don't decrease the effectiveness of your birth control method. Next slide. Moving on, tobacco and other drugs. This again, these type of this kind of usage will have significant ramifications even later on in life. So the choices that you make now early on in your life are very important. As you know, tobacco causes a lot of health damages. Most people know about the lung cancer and asthma and COPD, but a lot of people don't know is that tobacco use does increase your risk for cervical cancer. So that's another reason to stop smoking. Also, tobacco wrinkles your skin, and who wants that? So that's another good reason to not smoke as well. Alcohol and marijuana use can certainly dull your senses and make you less aware of what's going on around you. Even vaping has negative consequences to your lungs. There's been some studies on something called popcorn lung that can occur with excessive vaping. Liver disease can happen with alcohol use. Oh, I have a question. Wait, where did that go? I missed it. Wait, maybe, let me see. Is increased cervical cancer risk with the same as vaping? I don't think so. I think it's more of the combustible hydrocarbons that cause cervical cancer more so than the nicotine itself. So I think that vaping is more of directly related to more of a lung disease than cervical cancer. Good question, though. Okay, pregnancy topics. We are hopefully going to be getting a lactation specialist here at the VA. Right now, we are having to use community care for our lactation specialists, but we're hoping to get one to work with us here in Northern California. That would be great. When people become pregnant, we start screening for certain disorders such as gestational diabetes, and that checks your blood sugar. Also, we do a screening for hepatitis B and HIV. Also, postpartum depression screening is very important. We want to always screen for that and keep up on that. As well, we're hoping to get a mental health partner to work with us here selectively in women's health. And I think that would be a very good topic for our women's health, mental health people to get involved with. We do recommend starting prenatal vitamins prior to conception. Folic acid is a very important nutrient that should be started 2 to 3 months prior to getting pregnant to avoid something called neural tube deficit, which is a malformation of the spinal cord. So if you're thinking of getting pregnant, start those vitamins 3 months ahead of time. And we do have those here on our formulary. Next slide, please. Okay, so here's a couple holistic care tips for people in their 20s and 30s. During this time, premenstrual or PMS is very common. You can see there's 4 main types of PMS. We recommend that people be sensitive to this time and try to avoid stressors that may aggravate their condition. Increasing the fiber in the diet may be helpful, and getting gentle, regular exercise and stretching like yoga and Tai Chi can be very helpful during this time. There's certain botanicals that might help with this. Calcium and magnesium can help to fight the cramps and irritability. boosting your vitamin B6, and the tryptophan acts sort of like naturally occurring serotonin. So this may help with some of the mood changes that are associated with PMS. Chaseberry and black cohosh are typically considered to be menopausal botanicals, but they can also help with PMS symptoms as well, especially the mood changes. Ginkgo biloba has been recognized as a medication that can help with memory. It can be also used in PMS if people get the fuzzy-headed feeling. And then evening primrose oil has been long used for breast pain and breast tenderness, which can be very helpful, as well as decreasing the amount of caffeine in the diet. Okay, and next slide, please. I think we're moving on to the next. I think I have one more slide on the 20s and 30s. Okay. This slide just talks briefly about holistic care during pregnancy and lactation. I would say that I would be very cautious with using even herbals and botanicals during pregnancy. There are some botanicals that can cause uterine contraction, which may lead to premature delivery. You don't want to have that happen. So I would caution people very strongly against that. However, you can use aromatherapy during pregnancy, and that's totally fine. And things like lavender and peppermint and catnip oil can be applied on the skin in diffusers or added to baths to increase your sense of calm during pregnancy. And then after the delivery, fennel seeds and hop containing compounds can help to improve milk letdown and improve lactation. I think there's an old wives' tale that midwives would tell the new mom to drink a hoppy beer to get things going. So I think that the hop idea has been known for eons. But on the other side of things, if you want to help to reduce the breast milk production and decrease the breast swelling, drinking a tisane of sage or drinking sage tea may help to dry up the milk and reduce the breast swelling. So next slide, I think we're moving to the next decade. Yes, 40s and 50s. This is our time to shine. And at this decade, most people are experiencing an improved sense of self, and they tend to be a little bit more comfortable in their own skin. This is a time when we really start to recommend getting annual health checks because there's more things that the provider may want to keep an eye on. For us, we typically want to monitor the blood pressure, the blood sugar, and cholesterol levels annually. That's the so-called Know Your Numbers. You know, we have a Heart Healthy Month in February where we promote the Know Your Numbers campaign. And those are the numbers that we are typically talking about there. If these levels go unchecked, then they can go on to cause further liver damage, especially in the eyes and the kidneys and in the heart, in the vascular system. So keeping on top of these numbers is really important. We also do a one-time hepatitis C check, and we start to talk about the beloved colon cancer screening. I always sort of feel like a used car salesman when I'm talking about colon cancer screening, but it's actually very important. A lot of people say, can't I just do stool cards? And I would say that, stool cards are better than nothing, but Still colonoscopy is the gold standard, because if they're in there looking around, they can actually remove the polyp at the same time. So still, we recommend colonoscopies. Typically, people only have to do them every 10 years. If there's a lot of polyps, you might have to do them every 5 years. And sometimes colonoscopy screening is shifted to a younger age if there's a strong family history. So that's colon cancer screening. Now, breast cancer screening. I have a lot to say about breast cancer screening. We have a very robust breast cancer screening program here at Mather, and we have excellent technology here, and I'll go into that in just a minute. But our breast cancer screening, usually the average screening time is usually 50 to 74. However, we follow here at VA, we follow the American Cancer Society recommendation, and we follow the 45 to 55 annual rule. So actually, we dropped the age down to 45 to start mammography. There again, too, if you have a strong family history for breast cancer, you might want to bump it down to even 40 years old to start screening. After 55 or so, we could shift it to every other year of screening. And this is up to you and your provider. Some people want to stick with the annual checks, and that's fine too. The thing that we're starting to do too is do what's called an IBIS score. This is a score that helps to determine what the individual's risk factors are for development of breast cancer. If it's greater than a 20% overall lifetime risk, we might recommend alternating a breast MRI in with the mammography, and I'll show you an example of that. Also, it's important to know if the BRCA gene runs in your family, because that might lead us to screen you a little bit more closely too. Next slide. Oh, there we go. This is an example of an IBIS breast cancer screening tool, and the practitioner can punch in a couple numbers while you're there in the office, or later on they can do this little screening tool, and this helps to risk stratify if we should start doing something a little bit more aggressive. As you can see, this person that I did here has a 26.5% lifetime risk. So she may actually want to get a breast MRI every so often, alternating with the mammograms. Next slide, please. So these are some of our breast cancer services. We have a breast cancer nurse navigator here in Northern California, and this is a new position actually in the VA system. And what they do is they track our patients from the diagnosis on a abnormal mammogram, and they shepherd them all the way through their care. She's a very integral part in our puzzle, and making sure that all of our breast cancer patients get to where they're going. A lot of the treatment occurs in community care, so she helps to make sure that no one gets lost in the system and everyone's getting their treatment on time. Here at Mather, we have a breast MRI, which is very unique. I think we're one of the few VAs that actually has a breast MRI. We have mammography offered at Mather, McClellan, Redding, and Martinez. We also have ultrasonography at all those areas too. We're going to be having stereotactic biopsies here at Mather very soon. And so these are great tools to help to track our abnormal mammograms and get to the bottom of what's going on. And next slide. And moving on to pap smears. So pap smears typically start in the 20s. We start screening a little bit more closely after the age of 30. We start to do HPV code typing, and that way we can, again, risk stratify what patients are at highest risk for the development of cervical cancer. And here again, if you've had your HPV vaccine, you're going to have a less likelihood of development of HPV infection. And even if you've had HPV on a pap smear in the past, we would still recommend that you get the HPV vaccine because there's more than one virus that can cause this problem. And the vaccine covers more than just one type of HPV. During this time, too, we also start to consider getting routine vision and audiology checks to make sure your hearing is good and make sure you don't have glaucoma. The use of vitamin D and calcium is always a great idea. Making your bones strong now will make it more resilient against osteoporosis later on in life. And also in the 40s and 50s, we sometimes consider personal or family risk factors for adding statins or aspirin. And next slide, please. There's a few holistic care tips for this decade. Urinary incontinence is very common. It's a very frustrating issue, and research has shown that 50% of women don't really talk about it with their doctor, although it can affect their mental health, their sleeping pattern, and their overall quality of life. Next slide, please. So the most common bladder problems, there's overactive bladder and there's urinary incontinence. Overactive bladder is kind of the gotta go. They feel like they have to urinate even though their bladder is not full. So there's sort of a missed message sent to your brain. Sometimes these women can have problems with having to get up a lot at night to use the restroom. Urinary incontinence is often a stress incontinence where the person laughs or sneezes or coughs and some urine comes out. We do have medications for these issues, but sometimes they can cause more problems like dryness of the mouth. So there are some herbal suggestions that can be made, and there they are in the middle of the slide. The Lindera root extract, the horsetail, and the three-leaf caper bark extract can be used, and they're often found in a combo. These medications help to give more strength to the muscle, and they also have a soothing effect to the inside lining of the bladder, and that may help to decrease the irritation inside the bladder and make the oversensitivity improve. We also have pelvic physical therapy here, and that helps to retrain sluggish peritoneal muscles to support the bladder better so that you're not losing urine when you cough and sneeze. So that is available here too. We will hopefully be getting a nurse navigator to help us with this problem. And next slide, please. During menopause, there are some suggestions that we can make too. Eating lots of fruits and vegetables and lean proteins and avoiding triggers like caffeine and alcohol can be helpful. Avoiding super sugary or spicy foods or processed foods can sometimes be helpful for easing the hot flashes of menopause. Eating foods rich with phytoestrogens can also be helpful, such as soybeans and, oh, thank you, Rebecca, soybeans and tofu. The most common combinations of phytoestrogens contain black cohosh, which has been long used to help with menopausal symptoms. And those products are pretty commonly available over the counter. The other thing I would suggest is not to skip meals, because sometimes when you're riding that hypoglycemia curve, it can make you feel crummy, and hot flashes can occur during that time too. Okay, next slide, please. Here's the natural progression of menopause. I think probably one of the earlier signs will be irregularity in the menstrual cycles, and we start to see the periods kind of spacing out or doing some weird things. That's usually the first tip that a person might start to be heading towards menopause. And then hot flashes usually happen, and that is usually at like the mid-cycle time is usually the worst for hot flashes. But then again, keeping your weight good, mild exercise, all this should help with these symptoms. And then once you've had no period for a year, then you're considered menopausal. So before that, you're not quite menopausal. Sometimes that's frustrating for people. Okay, next slide, please. All right, we're moving along here. Here's 60s and 70s and beyond. So at this stage still, it's very important to continue with your annual health checks. And we usually continue preventive health care checks up until, later in life. In fact, we will probably continue preventive care and health checks up until, there's like less than 10 years of lifespan. But, that's kind of a difficult thing to gauge sometimes. We would like to continue keeping people as healthy as possible. And everything that we've said so far is as important in this decade as it is in any decade. We start to add a little bit more screenings for osteoporosis. We start to screen most people at 65. There again, that can be younger if a person has a family history for osteoporosis. Weight-bearing exercises and calcium and cholecalciferol, which is the D3, are the most important things to help to prevent osteoporosis. We can start to tone back on pap smears and mammograms after the age of 65 or 70. And IPV, which is interpersonal violence screening, we do that regularly. But in this age group, we start to make sure that there's no possible taking advantage of the vulnerable. So we check in on that pretty regularly as well. And then fall risk evaluation and prevention is very important in this age group. And we start to screen for these particular things after the age of 65 as well. One thing that we do in the office that's really quick and easy is the get up and go test. So that is if you can get out of a chair without using your hands to help you get out of the chair, that usually means that your muscles in your legs are pretty strong, which is good to prevent fall risks, falls. And next slide. There is a good way just to call attention to your core strength. And if you have improved core strength, then that will help with balance as well and help to prevent falls. So you can see there that this is just an exercise to be mindful about your core strength. If you do yoga, this is the so-called mountain pose. And I don't know if you can see. Well, let's see. I don't know if you guys can see, but you want to shift your weight a little bit on the heels. You want to keep your knees kind of soft and tuck your pelvis under. You want to kind of rotate your shoulders down away from your ears and try to keep your head over your shoulders. And by doing that, you're not kind of leaning forward or hunching forward and causing more imbalance. And next slide, please. These are just things that we recommend for all age groups. Eating the rainbow, getting exercise. This helps to improve your mood and helps to improve muscle tone and keep you at your goal weight. Sun protection is also very important. No matter what your skin type or skin tone is, this UV light damages the collagen in the subcutaneous tissue, and that will eventually cause sagging and wrinkling. So using a moisturizer in the morning with a little sunblock is always a good idea. And next slide. Oh, okay. Another important thing for a healthy lifestyle is reducing your stress. And these are some of the complimentary services that we have available at Mather. We're trying to get them at all the other sites as well. And we will be hiring another assistant to help get these complimentary services more widely available. And next slide, please. Okay, that's it for me. If you have any questions, can you, just pass them along, and I'll try to answer them at the end of the conference. Thank you.
Dr. Farmer, thank you so much. Thank you for your service. I know that there's a high demand for services now during COVID. And folks, you heard Dr. Farmer, take care of yourself, start early, and that way we can continue to gather here. All right. And next up to walk us through our U.S. Veterans Benefits, we have Karen Carter from the Veterans Benefits Administration. Karen, thank you for joining us. Welcome.
Thank you. Thank you. I thank you guys so much for the invite. I'm going to just let you guys know it'll be a little quick because just in respect of time, I know benefits can pose a lot of questions, and so I'm just going to jump right in. If you have any questions, you can throw them in the chat, and throughout the presentations, I can just go ahead and try my best to answer them. But just to get started, so disability compensation it's a tax-free benefit, so it's paid to veterans who have sustained a disability while they were in the military on active duty or a reserve or guard while they were on orders. Or an injury that may have been aggravated by serving in the military. So veterans who qualify for disability compensation have to have been discharged under conditions other than dishonorable. So even with an other than honorable or a general, those are okay. The other than honorable discharge, the VBA can make what we call an admin decision to whether or not a veteran could possibly get some kind of benefits for an injury. So excuse me 1 second. Oh goodness. Okay, my dog is trying to get out. But so veterans who have a current disability, so compensated veterans who are currently getting compensation, they can go in and file claims to add to their service. 1 second, please. Okay, I'm back. My apologies. I have 3 kids here and it's just not helping me. Okay, so let's see. So disability compensation, the ratings go in range from 0% to 100% in increments of 10, and that constitutes an overall combined rating. So a veteran who is 0%, I just want to make it clear that a 0% is considered a disability. That says that we at the VBA have recognized that that injury was incurred or aggravated by service. It's not considered a denial. And so we know that a 0%, although there isn't monetary benefits attached to it, we do know that the injury has the potential to get worse, and then a veteran can file a claim for increase, and we could try to get that rating moved up. So at 10% to 100%, the veteran is paid monetarily every month for that disability or disabilities, a combination. And at 30%, the veteran can add their spouse and children to their award to get an additional amount in their monthly compensation. Next slide, please. Okay, so some types of disability. Your original claim, that's your very first disability claim filed with the VA. Very first, whether it was 20 years ago or 2 weeks ago, your very first claim, whether it was a grant or denial, that's what we call an original claim. After that, any claim that you file will be considered a new claim, whether it's for an increase, whether it's for a secondary, whether it's a supplemental, those are considered new claims. So you only file an original claim once, and then after that, every claim is considered new. And so a new claim, again, is basically filed for additional benefits with the VA. We already have you on record, more than likely, or to add to your compensation. So that's a new claim. An increased claim, that's when a condition has gotten worse and you believe that it's gotten worse and you just let us know, hey, I want to file for an increased claim. My headaches have gotten worse. And so you'll file your new claim. We'll more than likely request an exam. We'll get those results and we'll determine whether or not that condition has increased, has gotten better, or is remained the same according to what the physician tells us, and the rating is made. A secondary claim is a claim that your service-connected disability has caused. So the secondary condition has nothing to do with the military. It only has to do with a service-connected condition. So if I have a back condition and a service-connected condition that is a back, I injured my back in the military. Well, now I believe that my knee issue is due to my back. Well, I would file a new claim with the VA and say, I want to file for my knee secondary to my back. And then again, we would request an exam. The examiner will provide an opinion as to whether or not that secondary condition is caused by that service-connected back injury, for the example. And then we would grant a decision based on that. A supplemental claim, now it used to be called what we used to call a reopen claim. So if a veteran files a claim and from the date of the decision for 1 year, that veteran has that time to file an appeal if they don't agree with the decision. Well, if that 1 year passes and that 1 year passes, the decision becomes final, but not final that you cannot file for it again. It just means that that particular decision is final. And when you come back to file that supplemental claim, what you have to do for us, though, is to provide us with evidence that we've never seen before in order for us to say, okay, this condition, although the veteran was denied for it previously, we're going to look at this evidence and see if now we can grant service connection for the condition. So a denied condition doesn't always mean that it's going to remain denied forever. With new evidence that is material to the condition and to the claim, it is a possibility that it can be granted. Next slide, please. Okay, so just again, and I know I'm talking really fast, and I do apologize, but if you have any questions, just please throw them in the chat, and when I'm done, I'll try to get them answered. So ancillary benefits, these are additional benefits to service connection. So the thing to remember with ancillary benefits, you cannot receive them unless you are already service connected. So with your original claim, a lot of times you're not going to say, oh, I want to apply for individual unemployability. Well, you're not yet service connected, so you wouldn't be eligible for that benefit. So with individual unemployability, we refer to it a lot as IU. That is a condition where, based on the veteran's service-connected condition or conditions, they cannot maintain gainful employment. And so if I have a back injury that for whatever reason prevents me from working, and working for us, it's maintaining gainful employment, which is any income that is below the poverty level. Okay, so if my back condition causes me not to work and make money above the poverty level, then there's a possibility that I may be eligible for individual unemployability, and that is paid at the 100% rate. So there's criteria for IU. So the veteran has to be 60%, a minimum of 60%, but an overall combination of 70%. And one of their conditions have to be a 40%. And so when a veteran is granted, so if a veteran is 60% and they're granted individual unemployability, then that's the veteran is telling us that they cannot work, they cannot make that money above the poverty level. So the VA will pay them at the 100% rate, and they are treated as a veteran at 100%. They get the benefit of tax exemption and some other benefits as well. Special monthly compensation, again, that's an additional monetary benefit to veterans who are service connected. And so sometimes a prime example is aid and attendance. So aid and attendance is something that a veteran, if they are already service connected, their condition prevents them from basically helping themselves. So they need the help from someone else, whether it be a family member or it be someone that they pay to bring inside. The VA will, if they're granted aid and attendance, the VA will give them an additional amount of money every month with their monthly benefit for them to pay someone or use that money to get the aid and assistance that they may need. Clothing allowance is another ancillary benefit. Prime example is one where some veterans, they're service connected for a skin condition. If the skin medication that they use, creams, if it has to completely damage the material. So if I have a skin condition and I use a cream and it can say it gives a stain on my shirt. Well, if I can take that shirt to the dry cleaners and have that stain removed, then I'm not going to get clothing allowance. But if that stain will not come out, whether I wash it, dry clean it, it does not come out, then I will be granted a clothing allowance, basically. Next slide, please. Okay, so this is really tiny, but I can see it. Dr. Farmer, to get our eyes checked, I need to make my appointment. But so how to apply? So there are various ways to apply for disability compensation. A lot of veterans use a private attorney or a VSO like CalVet, our Veteran Service Officer Partners. They assist the veteran in filing their claim. They can file the claim on behalf of the veteran. They can also be there to represent a veteran and stand there with the veteran if a veteran has a hearing before a judge. And so VSOs are great we work with a lot of VSOs in partnership to getting veterans their claims filed, checking up on the claim, making sure the claim is correct, helping the veteran file for appeals. And so you can do that way. If you don't have a veteran service officer, just CalVet is here. So they're one of our VSOs that are great in helping veterans get their claims completed. Also, the e-benefits, I just want to let you guys know the e-benefits website is going away. It's going to be sunset, and I think I was told probably April or May, probably by the summer. And so they're encouraging everyone to switch over to va.gov. And I'm told that on va.gov, you can use your e-benefits login information to access that, and you can file your claim that way. You can check the status of your claim, request records. And I actually use va.gov, and I use my Healthy Vet login information to obtain access to va.gov because I needed something and it worked. We can still submit paper application. I know everyone always says paper is going away. I'll never believe that. But so, you can still submit paper. You can download the application and complete it, email it. Mail it to our intake center. Our intake center is in Janesville, Wisconsin, and all paperwork, all claims go to the intake center and they're uploaded into your electronic folder. And that's how we at VBA establish your claim and start working on it. And so I just wanted a little note they had here. Evidence requirements. So just when you're filing your claim, as I always say, it's always best to if you've never done it, have someone assist you, talk to a VSO, come by where our office is close to the public. I don't even think I introduced myself, and I do apologize, but I am Karen Card. I work for the Benefits Administration of the VA. I work for the Oakland Regional Office. We have a satellite office in Rancho Cordova, and that's what I work out of. And so right now our offices are closed to the public, but however, you can go again, uh, evidence, get information, talk to a VSO. I'm going to provide a number in the chat so that we set up a VETS line because of COVID. And so you can call and speak to one of our team members in Oakland or in Sacramento to get you help with filing a claim, directing you to a VSO or whatever you need to file your claim. Just also it says here with the 4142, so that's just that evidence, to be mindful of the evidence that we need. So just prime example, if you file a claim and when you file your claim, we are going to get your treatment records from the military, your personnel file. But what we will not get unless you give us permission is private medical records. So if you've been seen by Kaiser and you want us to obtain those records, we can. There's just a form that you have to fill out, which is our release of information. And we will submit that release to the private facility and request your records. But we always tell veterans there's a chance that if they don't get it to us and you want us to have it, it's best for you to go get them and submit them with your claim. Next slide, please. Okay, just really quick. Pension is an income-based benefit and it's specific for certain veterans, and so not everyone is eligible for pension. Pension, again, it's for veterans. One, they have to be 65 or older. They have a permanent disability, and their I'm sorry, my clock is going off. And their net worth has to be below the current poverty level. They also have to have served at least one day during a wartime period. And so I'm so sorry, this clock. So okay. So, but yeah, so a lot of times we'll see veterans, like homeless veterans or veterans, again, who have that low income. The VA is going to look at which benefit is higher for the veteran. So you may have a veteran who's 70 years old and they're granted compensation at the 20% rate. Remember, compensation is for injuries that were incurred while the veteran was in the military. So I do apologize. I need to just yell to one of my kids to get my charger for my laptop. I apologize, but I hate to be cut off.
That's okay, Karen. We got you if you need to reset with that charger. And folks, if you have questions, feel free to send them through the chat. A reminder that this recording will be available following this event early next week. And you always, of course, have us at your service to answer any questions on today's presentation.
Okay, so hopefully my son can run and get that thing really quick. But yes, so pension. Yeah, so pension, again, it's income based. And so like I was saying, if a veteran is 20% for compensation for injury incurred in service, 20% right now, the monthly rate is about $285. So if a veteran, 20% is 285, but if a veteran's income is below that poverty level, that veteran can get in upwards of $1,000 a month if they qualify for pension. And so the VA is going to give that veteran the higher benefit, which is going to be the pension. And so again, pension is it's limited to who can apply for it. Next slide, please. Thank you. Plug this in for mommy. Come here. Okay, so special monthly pension. Special monthly pension is Again, the veteran has to be in receipt of pension already. And so what that does is, again, we talked about aid and attendance earlier. Aid and attendance can also be a person who's getting pension can also get aid and attendance. And so what it'll do is it's going to give the veteran additional amount of money every month. And so if a veteran say they're getting pension $1,000, the special monthly pension I think is going to bring it up about, I think almost $200 more. And so again, if they need the assistance of someone to help them, if the veteran is housebound, then they can get an additional monetary amount every month to add it to their pension to help them out. Next slide, please. Okay, so I even hate that they even put this slide, that the VBA added this slide, because they say how long, veterans, they always say how long, and again, I'm a veteran as well of the Army. How long will this process take? So a lot of things factor into it. The kind of claim that you file, the complexity of the disabilities, the number of disabilities, and the availability of evidence. That's why it's important. We always say, if I know back in the day when I got out of the Army, I got out of the Army 20 years ago, and when I got out of the Army, I snuck and had my medical records copied. And so it wasn't, to get your medical records back then was like, oh my goodness, you can't leave the military with your medical records. But and nowadays with the VA, especially present time, those records are electronic. We get those records so easily. It's just, you wouldn't believe it. But again, if it's an older period of enlistment, and you have those records, we're going to do everything that we can to request your records. We're going to request your whatever the military has, we're going to request it, and they're going to send it to us. And we just pray that it's everything that we need to decide a claim. Increased claims, they, in my opinion, they usually don't take that long, because the veteran is already established, the disability is already established, and we basically just need the examiner to tell us the current severity of the condition. Again, I hate time frames, because it's just, I get it all the time. Veterans will say, well, I filed my claim 2 months ago, and I've already seen, I've already had 3 exams. My buddy filed, 2 months ago, and he already has a decision. And it's like, don't try your best, because I know we all speak to our veteran brothers and sisters, and just try your best not to compare claims or compare conditions, because the condition that I have and a condition that, my husband is a veteran who has, they may be the same, but the issues around the conditions may be different, and it may, add some more time to a claim. So I just ask for your patience when you file your claim. I promise you, there are thousands and thousands of VBA employees working these claims, and, trying our best to get them done right, because, we are human. So, we make mistakes, but I just ask you for your patience, and get on va.gov and try to track your claim. You have a person in me, you have VSOs that can get in there and look at the claim, see what's going on, because, is there something missing? Pay attention to the correspondence that we send you, because although it is I always say it's legally, put together, we do have to, by law, tell you what we need, what we have done, and just pay attention to your correspondence. If you get a letter that you don't understand what we're asking for, reach out, ask us, call that 800 number, and see, what's going on, and just try your best to, again, be patient with us. That's all I ask. Next slide, please. Okay, so another benefit, just again, the benefits, VBA benefits, I mean, we could spend just hours going over it, but I do want to respect everyone's time and just move through it really quick. Education, another benefit of the VA, I am a beneficiary of the Montgomery GI Bill. And so there's just some some different types right now. You know, the post 9/11 GI Bill. We have GI Bill where it can be transferred to children, which is a great thing. We have the GI Bill for select reserves, and so education again. You know, VA is very VB. The benefits of VBA are very vast, and we have different departments handling different benefits. So education is another department. We at the Oakland Regional Office, we don't handle education benefits. For California, the education benefits are handled out of the Muskogee, Oklahoma Regional Office. And so those folks, if you call the number for education and you're in California, you're going to get Muskogee. Those folks are going to be able to help you out with education questions and things like that. So anything education related. And our system at VBA, I couldn't even look in the system and see what's going on with your education claim, because again, it's a whole nother department. But you know, if you called me and said what's going on with my education claim, I would more than likely directly direct you to contact education via phone, and hopefully they can help you out with that. Next slide, please. So the Veteran Readiness and Employment, or VRNE. So a lot of us, if you've dealt with VBA benefits, this used to be called Vocational Rehabilitation and Employment. So they've changed it a little bit. Again, it's a great program. The veteran does have to be service connected, at least 20%, but I do believe that a veteran can have a 10% rating. The 10% rating has to pose a serious disability, though, to prevent the veteran from working. And what it is, I mean, it's career counseling, it's job training, it's basically you go to school you can get a degree. You know, if your disability is preventing you from, you know, doing the job, that you have your current degree and you can go to school and get a different degree. It's a great program. I used it myself as well, and it's a really great program if you're qualified for it. Again, we do have VRNE in our Rancho Cordova office. We do have an office there. There is a phone number and everything. And so if you feel like, you know, your disability is preventing you from getting and keeping a suitable job, then possibly if you're interested in maybe switching careers and getting that training and that education, then VRNE may be a great program for you. Go ahead and next slide, please. And then home loan guarantee, another great benefit. I am another beneficiary of home loan guarantee. You know, my biggest thing with home loan, you do have to be you don't have to be service connected, but with the service connection, you can have your funding fees are waived. And so again, our home loan guarantee regional loan center is in Phoenix for the state of California. And so if you called the number for home loan, you would get more than likely the Phoenix office, and they would help you as best that they can. And so it's a great benefit. You know, veterans, I like I say, I do appreciate it. As a veteran, you know, sometimes, you know, you can sometimes get a loan that's a little better than VA, but, you know, I say as a veteran, you know, I've been fortunate to use that and benefit from it. I think this is the last slide, but next slide. Oh, insurance. Oh, I thought it was. Okay, so insurance is another one. You know, not a department that we deal with, but I feel comfortable enough. You know, VA doesn't have a whole host of life insurance for veterans. They have some, like the main ones, like the service members group life insurance. That's the one, you know, when we're in the service, we have that life insurance, you know, if we wanted to utilize that. And then what happens when you get out of the military, you have so much time to switch over that SGLI to VGLI, which is Veterans Group Life Insurance. Again, as a veteran, that's what I my husband and I currently have the VGLI, but there is a period, I'm not sure, but I can check the number of, I don't know if it's 90 days or 120 days. You have just a short period to switch that over, to continue to utilize that benefit. Now there's also the service members group life insurance for disability. So that's a newer one where a veteran who is service connected with basically a brand new, this is not it, this is extension, that's something else. But they have the disability life insurance where you can get this like a $10,000 policy if you have a brand new condition and you file within 2 years of it. Then you can use that. Family member service group life insurance. That's a benefit that helps with dependent children who have the service members group life insurance coverage. And so again, if you asked me about insurance, I would direct you to the VA insurance. I believe our hub is out of Philadelphia, if I'm not mistaken. But yeah, another great benefit of the VA. Next slide, please. Okay, and survivors and dependents. So for us survivors, there's the main two are DIC and survivor's pension. And so again, as veterans, we have to look at, I always tell veterans, especially when veterans pass away and they have survivors, if you're ever questioning whether or not you should file a claim for disability compensation, you say, oh no, I don't need the money, or it's been too long, or I have no use for the VA, or I always say, if you can think of your survivors. So if you have a spouse or you have children, think of them when if you're questioning whether or not to file a disability compensation claim, because I always say, I'm not going to sugarcoat it, extra money is always helpful, for one. And then for two, if something should happen to you, and there's a chance that, heaven forbid, you pass away, there's a chance that your survivors could get some kind of monetary assistance every month. That'll make a big difference. Okay. And so DIC, for example, it's a monthly tax-free benefit. It's paid to an eligible surviving spouse, dependent children, or parents of a veteran who passed away of a service-connected condition. So the veteran is alive, they're getting compensation, then they pass away from a service-connected condition, then this survivor can file for a DIC and get a monthly benefit for the rest of their life. And so it's a help. It's a help. And we can always help you with that. Your VSOs can help you with those claims. We can always answer questions. We are so time. Okay. And then survivor's pension. I'm sorry. I'm so sorry for time. I'm just looking back and forth. But yes, survivor's pension, the veteran had to be in receipt of pension in order for survivor's pension to get it. And again, that's income based on the survivor. And next slide. I think that's the last slide, the next one. And I do apologize. I can just go on and on. Next slide. I think it should be the resources slide. Yes. And so these are just some helpful phone numbers, websites. The 800-827-1000 is our it goes to our national call center, but I'll put the number to our vets line in the chat so that you can call us if you have any questions. But thank you guys so much. I do appreciate the invite. I do appreciate the time spending your Saturday with us. And please just have a great rest of your weekend. I thank Dr. Farmer and Rebecca and Calvet, Melissa, all you guys. Thank you so much. I do appreciate it.
Thank you very much, Karen. So much information, so many benefits available to veterans. And as Karen said, everyone, take advantage of the benefits. Not too long ago, I received a call from a dependent looking into his father's benefits as a Vietnam service member. So I always encourage anyone out there who is not taking advantage of benefits, as Karen emphasized, to do so, to get in touch with the VA, as at Calvet, our links, and we'll have Annette present a little bit later here as well. Fantastic. Okay. So we're going to reset a bit here. We're going to go into a women's history game, and then we will proceed with the rest of the agenda. We have Yolanda Hagan, a nurse out of the Women Veteran. She's a Women Veteran Program Manager out at NorCal VA. Yolanda, go ahead, take it on.
Okay. Hello. Sochi, there's some questions for Karen in the chat box. Do you want to just address those individually, or?
I'll answer them. I'll type the answer in while you speak. Go ahead, Yolanda, and I'll just get these questions. Yeah, thank you.
Okay, sure, no problem. So we're actually going to play a game. And so the game we're going to play is the Women Veterans History game. What I need you to do, here's the rules of engagement. There's going to be prizes involved. The prizes are provided by the volunteer services here at the VA. And so what we're going to do is you're going to write down the answer in the chat. The person who has the right answer, we're going to ask you to contact Vanessa through private chat. Now, to use private chat, let me tell you, you're going to go down to where the chat box is. It's a little question mark up top. And then at the bottom, it says to. Go ahead and select Vanessa on there. And she'll be at the bottom because her name starts with a V. And that's who you're going to be sending your contact information so that we can mail you your present or your prize. Okay? All right, so we're going to go ahead and get started. And I'm going to call out your name if you have it right. So here's the first question. Prior to women officially serving the military, how did women assist in military efforts? And Sochi mentioned this earlier today. Go ahead and type it in the chat. Auxiliary services? What type of auxiliary services? All right, let's go ahead and give it to Alinki. Alinki, yes. Next slide, please. So cooks, seamstresses, and nurses. So Alinki, go ahead and send a message over to Vanessa, and she'll get your contact information. Next question. Did women join as men to serve in the military? Okay, awesome. Isa and Joy. Joy got it. She was the first one to answer. So Joy, go ahead and send a message to Vanessa. All right, I just wanted to go over history a little bit here. So Albert Cashier was born Jenny Irene Hodgers, and she served 3 years in the civil service. Francis Clayton served several months in the Missouri Artillery and Cavalry units in the Civil War. And John Evans was Mary Owens, and discovered to be a woman after she was wounded in the arm. Wounded in the arm. And then Harry Buford, who served. Her name was Loretta Velasquez, but served as Harry Buford. Awesome. Next question, please. All right. In American history, when did women officially begin to serve in the military? Go ahead and type it in the chat. If you're not sure, throw out a date. 1800s, good guess. 1960, good guess. Civil War, good guess. Closer, give us a specific date, Alinki. Anybody else? Go ahead and give us another date. 1940? No, not quite. A lot earlier. It was in the Civil War, to give you a hint. All right, Joy. Joy got it. And it's actually 1917. And her name, so let me give you a little bit of history. Joy, go ahead and send the message over to Vanessa. So in 1917, it was Loretta Walsh. And she was the first female to enlist, and that information in there is incorrect. She wasn't a Marine, she was in the Navy Reserves actually. And the reason that she signed up, she was recruited because the recruitment for men was low. So they thought if they recruited a woman, then the men would look bad, so then the men would enlist. And so, or sign up. And so that's why they recruited her. Then a year later, in 1918, 7 women enlisted in the Marines, and then the number for the Navy went up to about 400 women who signed up, and they were doing administrative type duties. All right, next question. All right, what year and act were passed by Congress allowing women to permanently serve in the military? Go ahead and throw out a year. Now, let me tell you, before this, women were allowed to serve only during military contingencies. Cheryl, really good guess. Stormy, not quite. That's right, Cheryl. It was 1948. Cheryl, go ahead and send a message over to Vanessa. So in 1948, the act was called the Women's Armed Services Integration Act, which allowed women to actually now stay in military service permanently. They didn't have to get out of military service. All right, next question. What year were women veterans made eligible for veteran benefits? (1960, 1965? Good guesses. A little bit later. 1970, you're getting closer, Linky. 1980, Joy, that's right. But Joy, you have won so many, so let's go ahead and give it to Sandy. Sandy, you're close enough. Sandy, go ahead and send a message to Vanessa. So actually it was 1980. Veteran status was finally given to women who served in the Women's Army Auxiliary Corps during World War II. And it wasn't until 1985 when we were actually, the VHA was actually assigned a Women Veterans Program Manager. They were called coordinators at that time. And that's when our women's program really started to take action. And I believe there's one more question. Yes, what is the current percentage of women serving in the military? Throw out a percentage out there. 23? Close, not quite, Cheryl or Sarah. Alinki, not 60, not yet. 30%, not yet.
22.
Close to 22, but not quite. Dolores is a little closer. Nope. Okay, you know what, Alinki, you won already, so I'm gonna give it to Doris. Sarah's got it. Sarah, have you won a prize already? If you didn't, go ahead and send a message to, okay, great, Sarah. Go ahead and send a message to Vanessa. Yes, we're actually at 17% right now of women who are serving in the military. And I know this is a really small graph, but it just shows the breakdown of which services women are in. So but I know that you're interested in knowing the whole percentage. All right, there's one more question. This one's the last question. How many women veterans do we have in the United States right now? Go ahead and throw out a number. More than that, Alinki, a lot more. Oh, way more. 200 billion, million, 1,000, 100,000, more than that.
2 million.
Who said 2 million?
Patricia Jackson Kelly.
Okay, Patricia won. Patricia, go ahead and send a message over to Vanessa. You won a prize. And let me tell you, the prizes were actually packaged back in December. So what you're getting is a mystery to you as it is to us. Okay, because we don't remember what we packaged up. So I hope that you like them. All right, that is the conclusion of this part of the game. We will have one more game later on, all right? And you will be able to win more prizes. So, Chief?
Fantastic. Thank you so much, Yolanda. That was fun. Welcome, Patricia. Everyone, Patricia Jackson Cowley participated in Thursday's congressional hearing on Beyond Deborah Sampson, improving healthcare for America's women veterans. So thank you for that. We did get to see you on the screen. Fantastic. That was very fun. Congratulations to all of our prize winners. We are now going to welcome Annette Oliver, also a veteran, and a link with Calvet. Thank you, Annette. Good morning.
Good morning, everyone. Yes, I am the local interagency network coordinator, and that's a mouthful. We go by as LINK, but we're basically we're agents for the state, field agents for the state of California. And we work with federal, state, local, and government agencies, as well as other providers within our communities. Next slide, please. So on this next slide, this is how Calvet has divided the state. It's into 8 regions. Each color is a region with a coordinating link. And the 8 of us work independently within our regions to develop resources within our particular areas, but we also work together to assist each other whenever we have any need as far as some of the local emergencies that I'll be talking about come up. And we assist current and prior military service members and their families. So we want to make sure that we have a close network of providers resources. Next slide, please. So we provide outreach to service members, veterans, and their families, and we do it in a variety of ways, either by being with the local collaboratives, we're at DOD installations, talking to active duty service members, as well as community college, who are in a lot of cases recently separated veterans. And we work and we make referrals and work directly with these providers that we have established with, whether it's a Veterans Employment Committee or collaborative, to make sure that we can get the information that people need, because we want augmented services. Everyone knows about, I mean, throughout the state, we know about federal and state assistance, but it's with those collaboratives that we build up that close network, those individuals, the names that we can call to get people established with those auxiliary services. And then we assist with local emergencies. Last year, I was actually deployed to the Porterville LAC Local Assistance Center in Tulare, and I assisted with the Fresno LAC, where we gave assistance to veterans that were victims of the Creek and SQF fires. In some instances, their entire structures were destroyed, all their paperwork. But by working with our resources, I worked with the County Veteran Service Office, we were able to get copies of their DD Form 214, and also working with Calvet Home Loans, able to get their certificate of eligibility so they could go forward with either a VA or a Calvet home loan. And right now what we're doing is, since a lot of offices or lobbies are closed, are working remotely, the calls that are going into the 1-800 number at Calvet are actually being outsourced to us 8 links. So whether I get a call from Klamath Falls or San Diego, I'm able to assist them because I'm familiar with the state and federal agencies. And if we need more services, I can contact their coordinating link because they're the subject matter experts, and we can get them to the resources that they need. Advocacy to local communities by staying in touch with our committees. We want to make sure that they're connected with the benefits, that they're aware of them, but well, if there's any changes to benefits. Next slide, please. So I'm kind of the poster child for getting connected to your benefits. I'm a United States Army veteran, was mentioned. I served from 1975 to 1978, and I got out, used my GI Bill, got my degree, got my VA home loan, and I thought that's pretty much it. But it wasn't until 11 years ago when I started working for the state of California that I could realize I could file for compensation. So now I have a service-connected disability. And also I'm enrolled in VA healthcare. So it's amazing the benefits that you don't know you have. And so we want to make sure that you're aware of them. And in a lot of cases, these benefits don't expire. So I'm going to talk about, these are the agencies that we work with day in and day out, a part of our network. Employment and training is, of course, is the Employment Development Department, EDD. I actually worked as an EDD vet rep for 8 years. And what we want to do is we want to make sure that we connect veterans to employers, help them with resume writing, interview skills. In fact, EDD has dedicated staff. That's a grant from DOL vets that they work exclusively with veterans. So, and they also are co-located in the America's Job Centers of California. And these AJCCs, although once again, all of these offices, their lobbies are mostly closed, but you can call them and make an appointment. The AJCCs have the tools that you can use, whether it's computers to brush up on your resume, do job searching, use their job boards, file for unemployment, paid family leave, disability leave. Those offices are there for you. They can also get you connected to your veterans preference points. And I'll be honest with you, in 2009, when I was unemployed and I went to EDD to file for my unemployment, I didn't realize I was a veteran. I didn't realize I had those preference points. And during that time when unemployment was extremely high, within 7 months, I was employed by the state of California as an EDD vet rep. So look into these benefits. California state benefits, that's what CalVet is all about. Whether it's DMV benefits, it's fish and game, college tuition fee waiver, we are kind of there to make sure that you know about these benefits. But it's the County Veteran Service Office, the CVSOs. They are the boots on the ground. They are the administrator of those benefits, whether it's federal or state. So if you want to file for compensation, or if you want to find the status of your claim, get your DMV paperwork, college tuition fee waiver, they're still doing that business. They're doing it remotely in a lot of ways, but if you need to meet with them one-on-one, call, make an appointment, and they will see you on a need basis. Healthcare, we don't want to neglect our healthcare during this time. VA medical centers and clinics, the CBOCs and the vet centers, are seeing patients on an urgent and critical care need. I know my appointments have been through VA Connect, and My Healthy Vet is also a great way to get your prescriptions refilled, make an appointment online. And then the vet centers, they're actually triaging patients outside to see if they need to be seen. But make sure that if you need to get enrolled, you can either go online, it's a very easy process, or you can call them and ask for eligibility, and they can get you hooked up with your healthcare benefits. Next slide, please. So the difference between California Department of Veterans Affairs and the VA, well, the VA connects veterans with or military members with their medical services, compensation, pension, educational benefits. CalVet augments those benefits. We have our CalVet home loan. So we're the other VA, as I say. We can tell you about federal benefits, but our specialty is California state benefits because they do differ from state to state. So if you need information, if you're planning on leaving the state, I can get you information on there, but there's a lot of benefits. Even if you leave, you can take advantage of those CalVet benefits. Next slide, please. So if you remember nothing else, remember my contact information. I'm always available. Wherever you are in the state of California, I can get you connected to your individual link in your community, or you can call me and I can assist you in any way that I can. As a veteran and as a service-connected service member, I used a lot of these benefits that we have been talking about. So please feel free to call me and I'll get you connected. Thank you for your service and have a great day.
Thank you, Annette, for that overview on our services at CalVet. Folks, a reminder, if you need to get a hold of any of our presenters today or need more information, feel free to send us an email or send a question through the chat box. Okay, so we are now going to jump into a review of Women Health Services, and it will be presented by Yolanda Hagan. We're bringing her back. Thank you, Yolanda.
Thanks for having me. Next slide, please. All right, so, as we discussed a little bit early, the history of women in the military and Veterans Affairs, Sochi also mentioned a few earlier, so I'm actually going to skip this slide just because we have already been through that. Go ahead, next slide. And again, we have 17% of our armed forces is currently women in the military. Next slide, please. All right, the reason there's a lot of women who don't recognize that they are veterans, and we were wondering why is that? Why is it that 25% of our women veterans don't recognize themselves as veterans? The many things that I've come across with is that many women say, well, you know, I wasn't deployed, and so therefore I'm not a veteran. Actually, a few months ago, I had a lady tell me that her sister and her father were in the military, and her father told her sister that she was not a veteran because she wasn't deployed. And that really isn't true. And so the fact that you sign up, another veteran says, well, I signed up to, you know, for military pay or to pay for my education. And honestly, she says, I really am not a veteran. And that wasn't true. The fact that she signed up to serve means that she signed up to serve. She is a veteran. And then the other one, and this is a little bit of a gray area, is that I'm a reservist, and so therefore I'm not a veteran. And so even though you've served in the reserves or guard, you are a veteran. Whether you're eligible for services, there's a lot of little criteria that you must meet to be eligible for services. The other thing, a lot of women don't want to go to the healthcare system or don't identify themselves as veterans because they think when they think of veterans or the VA, they think of they think that it's their grandfather's VA, meaning that it's very male dominated, older men. And so they really feel awkward and they don't want to be there. And then the other one is that I hear often is that the VA doesn't have services for me. And all of these are misnomers. They're not true. Because when actually the other day when I was walking through the pharmacy, I saw 5 women and 2 men sitting waiting for their medications. And to me, that speaks to that there's a lot more women coming about. They're coming to the VA. I went to a Veteran Experience Council, and one gentleman said, you know, I went to the VA the other day, and all I saw was women. So the VA, the picture of the VA really is changing, where we are having more women come into the VA. The other thing that's changing is that with the military service, women are not staying in 20 years. The VA changed their structure about how they can get retirement. So a lot of women are going to do their 6 to 8 years of military service and get out. And so that's the new trend. What that means is that we're going to be seeing a lot more younger female veterans at our healthcare system. And we do have services to provide for our women veterans of all ages. Next slide, please. All right, so this is a picture of what the pack, let me rephrase that. So every healthcare system has, when you walk in, there's teamlets, and they're called patient-aligned care teams. What's very specific about a women's health pack team is that the provider and the nurse get very specialized training on how to take care of us, because I too am a veteran. And so what we ask you is that if you have not signed up for services, or if you have signed up for services for healthcare, and if you're not assigned to a women's health care team, that you call your local service provider there at the VA and let them know that you want to be reassigned to a women's health primary care PAC team, because it really is like a one-stop shop. Instead of going to several different providers for your care, or one primary care provider and then women's health, you can have it all in one. And that's the best way to get the services that you need. The other services that we have that a lot of women don't know is that we have a maternity care package that we're going to talk about in just a few minutes. But we also have, with these PAC teams, we have a pharmacist assigned to them, typically a social worker's assigned, and then we have ancillary services alongside with that. We have LGBT coordinator, MST coordinator, IPV coordinator, a suicide prevention coordinator. And so we have a lot of services for you. We also have GYN services for, if you want to have reproductive services, IUDs, if there's infertility, for contraception. So there's also surgical services if you need them. With maternity care, though, I want to let you know that when you are pregnant, you call your healthcare provider, they'll do a pregnancy test, and then you'll be assigned to a maternity care coordinator. And then with the maternity care coordinator, what happens is that she's going to take care of you throughout your pregnancy, the VA does not deliver babies. You are assigned to a community provider, but you're still linked with the VA. You're also given breast pumps if you plan to breastfeed, nursing bras, maternity belts if you need them, and then your baby is also taken care of financially for the first 7 days of life. That means that the VA will pay for all the bills for the baby for the first 7 days. And that means that if the baby's a boy and you want him circumcised, that you can definitely have him circumcised as long as the baby's hospitalized when this is happening. So there's a lot of services that are available to our women veterans. Next slide, please. All right, want to talk about the diagnoses with women veterans. The number one diagnosis that we see here in Northern California is PTSD and chronic and unspecified. The next one is hypertension or high blood pressure, and then subsequent to that is major depressive disorder, and then low back pain. And all of these can really be associated to military service. 60% of women say that they had a negative experience in the military, and then 1 out of 4 women say that they experience military sexual trauma. And I know that the military is doing a lot of training so that stops from happening, but we also have services to take care of our patients who have PTSD and who have major depressive disorder and who have MST. Next slide, please. All right, I'll answer your questions in just a few minutes. The musculoskeletal issues. So because we served and most of the gear is not really made for women, we end up having more injuries like low back pain. We have, because of the high impact activities, because of the heavy combat gear that's not really made for us, because of the influence of footwear. And so what happens with those? We end up having chronic pain. We have limited movement. We have reduced blood flow. We have some strains and sprains. And so when I got off active duty, my big toe was actually numb for the first 4 years and until I stopped wearing those boots on a regular basis. But what the VA has is all these other services to help you. We have pain management. We have physical therapies. We have orthopedics. We have occupational therapy. We also have occupational therapies. We have chiropractic care that I'll talk about in just a few minutes, and other complementary services. Next slide, please. All right, and then Rebecca's going to talk about the women's health social work services. Rebecca?
Okay, I unmute myself. Hi, good morning, everyone. Okay. All right, so I'm working with Yolanda Hagen, the program manager. So I'm the first full-time woman health social worker. We are hired in 2012, so they want to serve women better. So you can see that we have a lot of holistic care. So a lot of women using the Wednesday group is called video conference meditation group. We do Tai Chi, Qigong, also do tapping and then chair yoga with music. A lot of women joining us from home. And also because of pandemic crisis, we all also have a dial-in women support group because some women, they won't have Wi-Fi. So we're going to do the phone. So we meet on Thursday from 11 to 12. So average, we have 10 women, 8 to 10 women. We will do meditation, we do cooking skill, we share our life. Is really good support because we need that to connect with another human being during the pandemic, especially the mutilated sister. So we also have Social Security claim. So we have a partnership with Social Security office every month, 4-slot telephone appointment to help veteran to file for SSDI and SSDI and the SSI. So we have a lot of service, and I always want to mention about that. I know everyone kind of get to know Karen. Karen also will be working with me on the VA claim services. Women Health have a special VA claim services, especially for women with multisector trauma. I work in this field for many years as mental health social worker, so I understand how difficult it is. So I team up with Karen Carter and a couple of women veteran service officer to work together to file for claim. and then we do the phone right now. So we advocate and file for the claim at the same time. So we are not leave you alone and just until the claim is done. So if you want to get a phone appointment with Karen Carter, so please give me a call. Karen and I always talk over the team, team, and then we set up appointment, and then we do quick and file. You will get a phone appointment with Karen within a week, and then if you have anything that you want to get hold of Karen, I can do it too. So we're good, really good services, especially LGBT. We also take care of LGBT veterans. Another one I want to single out is holistic care. We usually have massage, Tai Chi, and yoga on site. But once pandemic is under control, we're going to have a certified massagers coming to provide you deep tissue massage. I would love the free massage too. So, and also we do have, because pandemic, I provide the phone support service, coaching service for veteran. So veteran can call me twice a week, 3 times a week, how many times in 1 month. So I will providing support and then coaching and make sure work on some problem solving skill. So basically, we also have a phone appointment services for employment. If you want to talk to a VS Veteran Service VBA Veteran Benefit Counselor, I can hook you up with a counselor directly. You can ask her how to do the benefits. So I have a lot of services there. Basically, Yolanda and I work really hard together, serve women, and we are proud to say that, Yolanda, women get more service than men compare. Men doesn't have massage, men doesn't have phone, doesn't have other stuff that we have. So we are proud to do it, and please support us to using our service. And also we're proud to work with Calvet and Melissa Washington at Alliance Services. We women team up to serve you guys really well, and then we want you to use our service. We advocate for you. One more thing that Yolanda and I working for outreach program. We're going to want to outreach a lot of male sexual trauma women. We will start to do the services, help them with the claim, housing, employment. So make sure those women will get to the services before a lot of women get to the homeless situation. We don't want that. So Yolanda, I'm working on it. So please give me a call if you want that. I can enroll you at Women Health very fast, and I work with Dr. Farmer. Dr. Farmer is a wonderful doctor. We serve you with our heart and compassion. So you can let me know, call me, email me. I love to serve you. Yolanda, anything? I talk fast. Hopefully you know what I'm talking. Okay, Yolanda, hit it. Anything you want to add, Yolanda?
Yes, thank you, Rebecca. Next slide, please.
Okay.
Yes, these are the outreaches that we are currently doing, and just wanted to share with you that we have, for Women's History Month, we have been working on the I Am Not Invisible campaign. The pictures down below are actually real women from the Northern California healthcare system who, and these happen to be employee veterans who wanted to get their picture taken. We are going to have a couple more events coming this summer for the I'm Not Invisible campaign. We're going to open up to the public. And so keep an eye out to our social media. And if you're interested in getting your picture taken, we ask you can wear your service dress if you'd like, if you can still fit into it. And so go ahead. We'll put those out. So because we do want our women veterans to participate. And the I Am Not Invisible campaign really is to bring more attention to that as women veterans, we need to be treated with dignity and with respect. We're also doing something with permanent portraits of our I Am Not Invisible campaign. We're having portraits placed at every clinic in Northern California. And what this means is that we just want to bring more attention that there's more women veterans among us here. And so we're also going to be renaming of spaces of a woman veteran. And I'm not sure how that's going to be rolled out, but we are renaming it after a woman veteran who has made a positive impact in the community. And then we're also talking about healthy aging and menopause, and that's why Dr. Farmer was speaking to that subject. And then in April, we are having a trauma and recovery workshop, and we're working with Calvet to put this on. This is April 7th. Is that correct? I want to say it's April 7th. Keep an eye out for that. And then for May, we are having several events. So keep an eye out to our social media because that's where all the events will be posted. And that's it for us. If there's any questions that were not answered, oh yes, I will do this in just a second. If there's any questions that were posted and that were not answered by the other organizers, please let us know. Okay, I felt like they were, but if they didn't, just repost your question. All right. So this is the part where we're going to ask for, if you're a woman veteran who's 75 years or older, to type your name in the chat, because we have a very special gift for you. All right. If there's a woman who is 70 years or older, type your name in the chat. And if you're having a hard time typing it in the chat, you can go ahead and just unmute yourself and tell us your name.
Gloria.
Gloria? Okay,
Yes.
Gloria. All right, Gloria.
75.
You're 75.
Patricia Jackson Kelly.
Gloria. Okay,
Yes,
so
I can't type.
It's okay. Don't worry about typing. We want to hear about you. So you're 75 years old. Go ahead and mute your background, okay? If you have your yeah, go ahead and mute. Everybody mute. I want to hear. Tell us a little bit about yourself. When did you serve? Where did you serve?
Oh, this is for Gloria?
This is for Gloria.
Okay. I served for, let's see, I served for 4 years in the Air Force. I was a nurse in Vietnam for a year.
Okay.
And married an Air Force pilot, but have been divorced now for 30 some years. I have 2 children, and I love all of the resources that Rebecca provides for all the women at the Mather VA. It's been spectacular.
Rebecca, thank you so much. Gloria, thank you so much. So what I'm going to ask you to do is, let's do this. Do you have access to the chat?
I'm doing this on my phone, and I'm not sure how to get to the chat to be able to type.
Okay. Gloria, let me see. Vanessa, can you try to get a hold of Gloria? Because Gloria, we need your contact information so we can mail you your special gift.
Yolanda,
Thank
I
you.
have Gloria contact information. I can send it to Vanessa.
Okay, perfect.
I
All
can
right.
do it.
Okay,
Thank you.
Great. We just wanted to really honor our veterans. You know, a long time ago, they didn't get the services they really deserved. So we really wanted to pay special attention and say thank you so much for your service, because you paved the way for us to serve. All
Thank
right.
you.
So next, so Chi, next.
Wonderful. Right on. Thank you for your service, Gloria. That was awesome. I appreciate it. Okay, so real quick, we have a scavenger hunt and then one more speaker before we close today's program. So I'm going to hand it back to Yolanda, who is going to walk us through the scavenger hunt. And I believe we have more prizes.
Yes, we have more prizes. So the scavenger, I just want you first to listen to the rule of engagement, because it may get a little crazy, okay? All right. So this is what we're going to do. The scavenger hunt, for this one, we're going to need to see you, because we need to see evidence of what we have asked you to go get, and we need to see that you actually have it, all right? So once I say that item, I need you to go grab it and then bring it and show us, type your name into the chat. And if you're having a hard time typing in, just scream out your name. I don't know if that's going to get too crazy. We'll see. All right. And then if you have your name and I select your name, because we're going to try to do first come, first serve type. And then we're going to ask you to work with Vanessa to get your contact information, okay? So if you can have your cameras ready, then we'll do that. In the meantime, though, don't have your cameras on until we ask for your name, because you're going to be typing your name in when you have that item. So what we're going to do is we're going to ask you to go grab your purses. Go grab a purse. Come on, organizers, let's play this. Go grab a purse. Here's mine.
Hey, how did you do it?
All right. So do you guys see me with my purse? All right. Sandy, do you have one?
Yes, I have one. Whoops, I don't know how to flip it.
Okay, that's
There.
okay. You're gonna hold onto your purse because the scavenger hunt is in the purse.
Oh, okay.
Yeah, okay, so I'm gonna grab a couple of things, and I want to tell you that I have crazy things in my purse. And this is not just for today, this is all the time. Okay, this is just what I carry with me, because you never know. You gotta be prepared, right? That's what the military teaches you. All right, the first thing I'm gonna pull out is, do you know what this is? This is a straw. Who has a straw in their purse? Pull it out. Type your name in the chat box. And if you're having issues with chatting, then go ahead and unmute yourself. Alinky, I don't have a purse, Stormy. Grab a bag, any bag, with stuff in it. So this is what my straw looks like. See? Because, I'm trying to save this. Yeah, if you don't have it. So
Okay.
I'm trying to save the world by, using one straw.
Oh, mine's plastic.
That's okay, as long, Alinky, go ahead and I want to see it. I want to see your straw. Okay, Alinky was the first one who mentioned it, right? Let me see. Well, I'm sorry, I stand back. It was Sarah. Sarah?
Yep, I've got mine here.
Okay, Sarah. Go ahead, and I think you won a prize before, is that correct?
Yes, ma'am.
Okay, we'll just send you another prize. Go ahead and communicate with Gloria, all right?
Yes, ma'am. Thank you.
Okay, all right. The next one, and this one I think maybe some people have, this is actually my charger for my phone. So if you have a charger, pull it out. Oh, type your name in first, and then pull it out. I always carry it, because you never know, right? You may just be down on your back. Okay, who's that? Who's the charger? Annette? All right, Annette. Let's show it to us, Annette. Okay, Annette, go ahead and communicate with Vanessa. You have won a prize. Okay, what else do? Oh. Okay, I don't know if you guys have this. You may call me crazy, but I have a tape measure. I carry a tape measure with me. Who has a tape measure in their purse? Anybody? Or is it just me?
I took it out and left it in the office.
Do you really, Sochi?
Yes, when I started at Calvet, I just left it at that desk, and because I used to carry it in my bag. A lot of the freebies. So we go to conferences and we get those freebies.
Yeah.
Yeah.
You never know when you're going to need one, right? I mean, that's just. So does anybody have a tape measure in their purse or a bag or a backpack? If you do, you're going to win a prize. And Stormy, you wrote in. Do you have something, Stormy? Anybody?
Stephanie says she does.
Stephanie? Okay, hold on. Let me see here. Get lost. I do. Stephanie. Okay, Stephanie, let's show it to us. Let's see. While you're doing that, I'm going to see what else I have in here. Okay.
Yolanda,
All right.
found it.
Okay.
Hi, Nestor.
Nestor, good try. I bet Stephanie won this one, okay? I know. Okay, now this one's a little crazy too. Here is, I know you're going to think I'm crazy, but I have a travel eating pack, a little like fork and knife. And I got these when I was in Japan for a TDY. I was there. I went to the Daiso. Love Daiso. And they have chopsticks in here. They have a fork and a spoon. All for $1. Alinky, you have one? Alinky, if you have it, show us. Show the evidence. Do you have your camera, Alinky? I want to see it. I think we all want to see it. Look at that, Alinky. Awesome. Okay, Alinki, go ahead and message Vanessa. And I think you won a prize already, so you'll get 2 prizes. All right, this is the last one, okay? Gotta find something crazy in here. Okay. Well, let's see here. This I think everybody probably has. I have a little notepad that I carry with me. Who has a notepad? Joy. Joy has a notepad? Okay, Joy, go ahead. You know, let's do 2. Joy and Sandy. Show us evidence. Okay, Joy, nice. All right, Sandy, let's see yours. We'll have 2 winners for this one because it's the last one.
Whoops, I can't get where the, hold on.
I do, Rebecca.
Oops. Oh, here it is.
Okay, do you see the little camera?
Can you, oh, wait, can you see it?
Sandy, I don't see you. Let me see. Did you press the little camera button when you hover down below?
Whoops. Yeah, I did push it.
Okay, you know what?
Wait a minute.
It's
I can't
okay. We
flip
will
it.
take. How heavy is your purse, Sarah?
Oh,
It's actually not
I
that
don't know
big.
how to flip it. Oh, wait. Can you hear me now?
Okay.
I don't know.
And that's okay. We will take your word for it, okay? So go ahead and communicate with Vanessa, and she'll get your information. I think you've won something already, though, so she may have it. All right, so those are the items. I have more, but, and honestly, my purse, you guys, is not that big. I just know how to pack stuff in it. All right, that's it. Thank you so much, Xochitl.
Thank you, Yolanda. I'm going to be on a mission to find my additional tape measure and throw it back in my bag. So I know I have another one. That was fun. Wonderful. Okay, so we are now going to welcome Melissa Washington, Chief Executive Officer of the Women Veterans Alliance, providing a full hub network for women and all folks, and an array of services through networks and connections. So welcome, Melissa. Thank you so much for being here.
Thank you so much, Hist. I greatly appreciate it. Greatly appreciate you there at Calvet and your team, as well as VA Northern California. I'm very honored to be asked to be on this call, and I'm very proud of our partnership that we've created here in Northern California. And I am thankful for all the services that we do have for women here in Northern California, as I speak with women every day across the nation who do not have a lot of the programs that we do. So again, thankful for all what you ladies do to support our women in the community. So it is Women's History Month, and I know we are past time, so I greatly appreciate all of you that have stayed on. I will be real quick. I'm sure I know a lot of you know me and my organization. Just our organization, we are a nationwide organization. I did start it here in Sacramento, but bottom line, we are here to connect women with each other and women with resources. And I know it's Women's History Month, but I want to let everyone know at Women Veterans Alliance, we celebrate and honor women veterans 365 days a year. So even though it's Women's History Month, it's great, but we will still continue to honor you the rest of this year and going forward. So can you go to the next slide, please? So there's 2 organizations that I started, Women Veterans Alliance and Women Veterans Giving. Women Veterans Giving is our nonprofit partner that provides 2 programs. One of those is our Small Business Award. To date, we've given over $10,000 to women veterans to expand or start her business. This year, we will be awarding a small business award. So if hopefully you're on our email list or following us on social media, as later this year, we will be launching the application for that. So if you're looking to start a business or expand your business, this is your opportunity to get money, and it could be up to $5,000 that we will present you for that. And also too, we have scholarships to attend RN conference and other conferences. So let's go to the next slide. So we are a reliable resource for women veterans. If you've been to our website, our main focus too, again, is connecting women. And the best way to do that is through our infrastructure that we've created which is our online platform, our website, as well as connecting women on social media. We are women veteran founded, women veteran led. If you want to go ahead and I'm just going to skip on through here, as it is lunchtime for us here in California. So our online directory, we have a directory of women veteran organizations that are across the nation. So you can go on and look under our directories. We have an allies directory of all of the women veteran organizations throughout the US. And we have the only online directory for women veteran-owned businesses. So if you're looking to do business with the women veteran, check out our directory. And if you are a women veteran business, please feel free to reach out to us. You can get on our directory. And we also do provide coaching, counseling services for women that are looking to start a business or get more information, and also career services as well. We have a great online national event calendar. So if you have an event, send it to me and we can post it. And also too, you can search our calendar by zip code, state, keyword, and all the different events that we have there. If you want to go to the next slide. So if you can't, or if you haven't heard of the Unconference, you're missing out. October 8th through the 10th at the Tropicana Resort, Las Vegas, Nevada, we will have our 6th annual Unconference. It's our signature event. It's a 3-day weekend, and I'm sure many of you that are on the call that have been there, you're probably shaking your head. It's a don't want to miss event. We are currently having registration open. Early bird pricing is right now, which will go up in a couple months. So if you're interested, go to womenveteransunconference.com. And during that conference is also where we present the Small Business Award there that evening. So if you can go to the next slide. Very good. Here's my information. If you forget it, just Google my name or Google Women Veterans Alliance. I guarantee will pop up. We're on all social media, so connect with us. And since this is a Northern California Women Veterans Healthcare call, I do want to share an event that we have coming up for all you in Northern California. Is if you're familiar with Cabby, they provide, they have clothing lines for different women of different ages, different sizes. And up here in the Sacramento area, they chose Women Veterans Giving to be able to, in a sense, bless women veterans with some brand new clothing and stylists. And this will take place May 14th. And I'm going to put in the chat. So if anyone is here in Northern California, May 14th, if you're interested, we're probably looking at least 2 new outfits that you'll be able to receive on May 14th. You do need to register. I recommend, if you were interested, register soon. If you know anyone, please send that to them. It's going to be a fantastic and uplifting event to get some new clothing. And also too, if you're in the greater Sacramento area, our monthly meetups are going to start back next month, April 15th, which is a third Thursday. And we're going to be having dinner up in Woodland at a restaurant that's owned by a woman veteran. So again, I know I went very fast, but I just wanted to thank all of you for joining us here on a Saturday.
Thank you very much, Melissa. That is right, 365 days. Folks, we are here to serve you every day. I saw a question on the chat about services in Southern California. Yes, we do have services through the USVA, USV Healthcare, as well as Calvet. We have links in Southern California. Please reach out to us if you need to get contact information to your local USVA or local interagency network coordinator. Melissa, thank you very much. At Calvet, year-round, we celebrate our women as well. I want to encourage you all to visit our Calvet Connect blog. We have been highlighting some women veterans out there who are doing great things for the community. We have Christy Hayes, U.S. Air Force veteran in Northern California, who also assisted with providing meals to our veterans during the COVID pandemic, and much more. Then we have Ebony Strader, U.S. Army veteran, success story for our Calvet Home Loan Program. So do read her story. And coming up very soon, Carol Ann Wonderland, U.S. Air Force veteran. She is a champion up in Northern California. She is, I'm sorry, that is a Bay Area for Carol Ann, and she is a founder of her local American Legion and doing all sorts of other great stuff. So visit our Calvet website, as well as our Calvet Connect blog, to read more on our veterans. I want to thank you all very much for joining us today. If you have any questions on today's screening, feel free to reach out. We will also present this information posted on our website early next week. That will be available. We will follow up with an email to everyone who registered for this webinar and send you the link as well to our video and information on where to contact us. With that, have a great Saturday. Have a great weekend. If we didn't get to your questions, we have them logged, and also feel free to send them through our website. On behalf of Calvet, Dr. Vito Imbasciani, Calvet Secretary, thank you for joining us. Enjoy your weekend, enjoy your month, your year, and every day, my fellow women veterans. Take care. Thank you, guests.